The donning process is conducted under the guidance and supervision of a trained observer who confirms visually that all PPE is serviceable and has been donned successfully. The trained observer should suggest to the healthcare provider that they attend to personal needs such as using the bathroom and hydration prior to donning PPE. The trained observer uses verbal commands and a written checklist to confirm each step in donning PPE and can assist with ensuring and verifying the integrity of the ensemble. No exposed skin or hair should be visible at the conclusion of the donning process.
We're going to work together now so that you can put on your personal protective equipment in a way that's safe. I'm going to be giving you verbal commands, and then I'm going to ask you to repeat them back to me. We're going to go slowly and methodically because my job is to keep you safe. Please let me know if you have any questions or concerns as we go through this process.
All footwear should be closed-toed and closed-heeled with no holes. No personal items such as jewelry, watches, cell phones, pagers, or pens should be brought into the patient room. Ensure your nails are no longer than a 1/4 inch so you do not puncture the gloves.
The first thing I'm going to ask you to do is to remove any jewelry or anything that's around your face or your waist, your head or your waist. Make sure that there's no hair around your face. Make sure it's pulled back securely. You also want to make sure you don't have your ID badge on, and remove anything from your pocket, so a pen, a pager, or a cell phone.
Visually inspect the PPE ensemble to be worn to ensure that it is in serviceable condition, that all required PPE and supplies are available, and that the sizes selected are correct for the healthcare worker. Test the PAPR to ensure that the battery is fully charged and the airflow is working properly. Visually inspect the PAPR hood to ensure that there are no cracks in the face shield and the hood is intact. The trained observer reviews the donning sequence with the healthcare provider before the healthcare provider begins the donning process and reads it to the healthcare worker in a step-by-step fashion.
Do you see any problems with the equipment? No? Okay, great. Okay, now I want you to go ahead and use the alcohol-based hand rub, hand sanitizer. I want you to make sure that you're using it all over your hands, including between the fingers and on the backs and fronts of the hands. Then allow it to dry. Now we're going to put on the boot covers. For your safety, go ahead and sit comfortably and take your time.
Make sure that all areas of the foot are covered and the shoe covers are snug. Try not to touch the floor or other areas with your hands while putting the shoe covers on. If you do, disinfect your hands before putting your inner gloves on.
Now we're going to put on the first pair of gloves. You can put these on as you would normally. It does not have to be done in sterile fashion. Now we're going to put on your gown. Please inspect it and make sure there's no holes or tears. And then you can hold it up in front of you. The inside of the gown should be facing you, and you want it positioned so that the ties and the holes are in the back.
Ensure the gown is sized properly and large enough to allow unrestricted freedom of movement. Tie the gown securely, but in a manner that it can easily be untied when you begin the doffing process. Leave some length of the tie so that it can be pulled and untied without much effort. Ensure cuffs of the inner gloves are tucked under the sleeve of the gown. The trained observer will hold the respirator at the small of the back while you fasten the belt around your waist snugly and secure any loose straps. The PAPR battery pack filter unit should be on the outside of the gown to ensure proper airflow. Put on the second pair of gloves with extended cuffs. Some facilities may choose to use outer gloves of a different color to easily identify rips or tears. Ensure the cuffs are pulled up and over the sleeves of the gown. It may be necessary to ask the trained observer for assistance when putting on the outer gloves. Double gloving provides an extra layer of safety during direct patient care and during the PPE removal process. Put on the single-use PAPR hood that fully covers the neck and extends over the shoulders. Be sure that the hood covers all of the head and the hair and the neck and ears, and that it extends past the neck to the shoulders. The trained observer will attach the PAPR tube to the PAPR hood, making sure the tube is snapped and fits, and then turns on the PAPR battery pack and filter unit. If a PAPR unit should stop during patient care, you must leave the patient area immediately. After observing the donning process, the integrity of the ensemble is verified by the trained observer. The healthcare provider should have an unobstructed field of vision through the hood. Before you move from the patient room into the doffing area, you will need to take a few minutes to do some important things. First, inspect your PPE. Are there any obvious signs of contamination or materials on it? If so, then you will need to disinfect the surface of the PPE with an EPA-designated disinfectant wipe or an alcohol-based hand rub. Next, disinfect your outer gloves with an EPA-designated disinfectant wipe or alcohol-based hand rub. Last, get the attention of the trained observer. You, the trained observer, and the assistant are a team throughout the doffing process. The trained observer will read each step aloud, giving you the time to take the required action. The assistant will help you when necessary. Remember, don't rush through the doffing process. Take your time and be careful. Once the trained observer signals to you that it's clear, enter the doffing area. You will need to disinfect your outer gloves again with an EPA-registered disinfectant wipe or an alcohol-based hand rub.
Next, I would like you to remove your shoe covers. You can use the chair to make it easier.
In the doffing area, you will have two chairs. One will be where you sit to take off your shoe covers only. This chair will be designated as the dirty chair. It is preferable for the healthcare provider to remove their own shoe covers, but they may receive assistance if necessary. Once you sit down, be careful not to touch one leg with the other. Then grasp the outside of the shoe cover and pull it off of your heel, then toes, and then dispose of it into the trash receptacle. Now you'll need to disinfect your outer gloves again with an EPA-registered disinfectant wipe or an alcohol-based hand rub.
In the next step, you're going to remove your outer gloves. Please do this slowly and carefully to avoid any tears or any contaminations. You're doing great.
You have two very important things to remember. First, pay special attention so that you don't contaminate or tear the inner gloves. Second, don't snap the gloves, which might cause contamination to spray. Hold one of your wrists so that your thumb points to the ceiling. Pinch that glove and lift at the wrist. Then roll it down until the glove is completely off your hand in a ball in the palm of the other hand. Then, slide a finger down and inside the outer glove on the other hand and pull it off until it's balled around the first glove. Dispose of the gloves.
Good job. Now inspect the insides and the outsides of your gloves for any tears or contamination.
If you don't see any tears or signs of contamination, then you will disinfect your gloves with EPA-registered disinfectant wipes or alcohol-based hand rub and proceed to the next step of removing your respirator. If you see a tear, hole, or signs of contamination in the inner glove, disinfect with EPA-registered disinfectant wipes or alcohol-based hand rub and then remove the inner gloves, making sure not to contaminate your bare hands. Once the gloves are off, perform hand hygiene with alcohol-based hand rubs on your hands. Then, put on a new set of gloves up to the edge of the gown sleeve. In this step, you will be taking off your belt-mounted respirator. First, the assistant will detach the hose from the hood. Then, while the assistant holds the belt unit in their hands, you will unclasp the belt. After removal, place all reusable PAPR components in a designated area or container for later disinfection. Next, you will take off the hood. The assistant will stand behind you and will grab the outside of the hood and roll the hood up towards the top of the shoulders, forming a cuff. Then, when the observer signals both of you, you will grab the hood near the ears, bend forward at the waist, and pull the hood slowly and methodically down away from your head until it's at waist level. Then, discard the hood into the trash receptacle. It's very important to avoid touching your face at this point after the hood has been removed. Both you and the assistant will disinfect your hands with alcohol-based hand rub. Next, you will remove your gown. First, release the tie, and then pull the gown down away from your body.
Be sure to move slowly to avoid any contamination of the exposed surfaces.
Once the gown is off your shoulders, pull the gown down one arm and then the other. Roll the gown inward as you progress downward until it's a tight ball. Dispose of it like you've disposed of everything else to this point into the trash receptacle.
You're doing great. Please go ahead and disinfect your inner gloves. Please have a seat on the clean chair so you can disinfect your shoes.
Once you're sitting down, use the EPA-registered disinfectant wipes to thoroughly disinfect all the surfaces of your shoes, moving from top to bottom and including the soles. Be sure not to touch your ankles.
We're almost there. Please disinfect your gloves again. Now we're going to remove your inner gloves. We're almost there. Please do it slowly to avoid any tears or contaminations of your hands.
As with the outer gloves, you have two very important things to remember. First, pay special attention so that you don't contaminate your hands. Second, don't snap or pop the gloves, which might cause spray. The process to remove the inner gloves is the same as it was with the outer gloves. Hold one of your wrists so that your thumb points to the ceiling. Then roll it down until the glove is completely off your hand in a ball in the palm of the other hand. Then, slide a finger down and inside the glove on the other hand and pull it off until it's balled around the first glove. Dispose of the gloves. And remember, all trash should be emptied into a biohazard waste bin. Once your gloves are off, it's very important that you don't touch your face, any exposed skin, or any surface in the room. Next, perform hand hygiene using alcohol-based hand rub on your bare hands. Now you, the assistant, and your trained observer will do one last inspection of your scrubs and inner clothing for holes, tears, or contamination. Congratulations! You've now successfully finished the doffing process, so you can leave the doffing area.